Hi, I'm Dr. Kelly Starrett with H-Wave. One of the questions we get that's common from our patients and athletes using H-Wave is, can I move around or do I have to be sedentary with the H-Wave on? Well, the good news is the best effect of the H-Wave is to put the limb in a position, especially if I'm using this low frequency pumping, where I can get a maximum contraction where my body isn't trying to override the signals for movement that the device is putting into the muscle. So I'm trying to put my body into a position where I'm not going to be irritated and in a sort of really relaxed state, so I can get a big, massive contraction while I'm hanging out. But the great news about this tech is that it's portable. It just has a couple cords, which means that I can easily stand up and go about doing what I need to do. And then when I have a moment, I can sit back down again and sort of take full advantage of maximum contraction. But in something like the back or a shoulder, oftentimes we find that, if someone's in a sling, we can actually just slip this device right into the sling with them. And all of a sudden, we've got contraction going on, maybe to a lesser degree, but we can continue that contraction going on. And so instead of having to be sedentary, having to be sort of put in one place during the treatment, I can actually continue to move around. It might attenuate the quality of the muscle contraction, but as soon as I stop and sort of get into a better position, it'll just pick right back up again. So clearly, maybe if we're not doing surgery, maybe not a good pump. Maybe if I'm not driving my car, I should be doing that. But what you'll find is that this is a really simple way to integrate this into your life. So if you find yourself at the desk, it's a perfect time to be working and decongesting or even working on some on-demand pain relief. Then if I stand up, I need to go move around the office, I can even disconnect it, or I can keep it connected and just sort of override the signals with my own body. As soon as I stop again, the signals will pick right back up and I'll start decongesting again. The bottom line is you don't have to be stuck in one place while using the H-Wave. Feel free to move around. When you get steady and in a better position, it'll be more effective. But any muscle contraction, any movement, any high frequency signal is better than none.